So the latest COVID variant is Omicron BA.5. It's the most infectious to date. The plus is patients who get it aren't as ill as they were with the previous variants. Doesn't mean that you guys aren't still at pretty high risk for this. So definitely something to continue to mask. Be careful where you go, wash hands, all of the usual that you've been doing. So don't let down your guard. That's key. Would it make sense to have Paxlovid on hand given that the variant is very contagious and Murphy's Law says you get sick on weekends and when you're away from home? Short answer is it would be ideal. Reality says the drug is in relative short supply, so that's a difficult thing to do. There is pending legislation or FDA review to let pharmacists do this, but I would say realistically you probably would have to go to a local urgent care. They're prescribing it actually quite freely, so I don't think you'd have any trouble whatsoever getting the drug. Are there any drugs that interact with any of the pulmonary fibrosis medications or medications that patients with PF take? Oh, so good question. Not necessarily with any of the pulmonary fibrosis drugs, so specifically OFEV and Esbriet, otherwise known as nintedanib and Esbriet. Thank you. See, thank you. But, so there are some secondary medications that patients may be on, so such as pulmonary hypertension drugs, so sildenafil, tadalafil, those interact, bosentan interacts. If you're on blood thinners, definitely can't take Paxlovid. So to be honest, it's probably actually better to check in with either an urgent care if you're out of town. Most of them are really aware of this, or your local emergency room if your oxygen levels are low or you're having trouble breathing. Then regardless of Paxlovid status, I would definitely recommend you go to the nearest emergency room and have them check you out to make sure you haven't developed COVID pneumonia in that setting. But definitely there actually are online tools that you can actually plug in medications that will also help you to know if there's interactions with your drugs. But definitely you'll have to talk to the pharmacist because they'll look at your med list and be able to tell you right off the bat if there's an interaction. So one more thing to know about Paxlovid. There is a rebound that we notice. So patients will get on Paxlovid, they will feel great, take their 5 days, and then a few days later or within 24 hours after stopping, the symptoms may recur. We're not quite sure why that is at this point in time, but patients should just be aware that that can happen. They should still continue to follow through with quarantine and the usual care that they're doing, but it's just one of the things to be aware of.